Let's talk about LASIK postoperative instructions. Realize that your doctor might have a different variation. After surgery, you might feel a little discomfort, such as a dry, scratchy feeling. This is normal, and it should go away after a day. If it bothers you, you can take any over-the-counter pain relief medication. Sometimes the dry feeling can persist for weeks, and frequent use of preservative-free artificial tears should help. For the first 20 days after surgery, you should use your artificial tears frequently, in between your medicated drops. Your eyes might also be watery, blurry, or red in the first day, and sometimes longer. You might also have a runny nose. This is all normal. During LASIK, we put a small suction cup on the eye as part of the procedure. This can cause small red areas around the eye, and this normal pattern should go away in 2 to 3 weeks. When you get home, rest your eyes and go to sleep 1 to 2 hours later. This will start the healing process. You should set an alarm for yourself so you can use your artificial tears and your eye drop medications at the right increments. You'll also need to wear the eye shield you have been given for the entire first day, and also the 3 to 5 days after surgery whenever you sleep. This prevents you from rubbing your eyes while sleeping. When you're awake, make sure to blink normally, and don't squeeze the eyes closed or rub them, as doing that could lead to a problem with your LASIK flap. You should not drive or operate machinery on the first day after surgery, and let your doctor tell you when you're safe to drive after that. Now let's talk about your vision after LASIK. For days to weeks after surgery, it is normal for your vision to go in and out of focus. Most people have substantially better vision by 1 week after surgery, although some take longer. You can expect distance vision to get better faster than reading vision, although the amount of improvement in reading vision will depend on your age. In the first weeks, you might have night glare, which is normal and gradually goes away in most people after 6 months. If it seems like your eye isn't healing correctly, or you are having persistent pain, redness, and blurred vision in the first 24 hours, you should seek attention of your physician. Flap complications are rare after LASIK, but the first 24 hours is the most common time to have this complication. This is also why we ask you to return to clinic the day after surgery. So what can and can't you do after surgery? Here's what you can do. TV and reading are okay in moderation for the first few days. Sunglasses should be worn anytime you have sun exposure. You can resume your normal light exercise routine 2 weeks after surgery, as long as it doesn't involve contact sports or risk to your eye. Contact sports and other activities which carry eye risk can be restarted 1 month after surgery. Most people can return to work the next day. Here's what to avoid. Keep water out of your eyes in the shower or bath for 4 weeks. Avoid rubbing your eye for 3 months after surgery. Don't swim or go in the hot tub for 4 weeks. Don't use makeup or aftershave for 1 week. And stay away from dirt and dust. Lastly, don't forget about the medicated drops you were given. You should take these drops exactly as they are prescribed and according to your doctor's instructions. You may begin putting them in 4 hours after surgery, unless instructed otherwise by the doctor. They will sting a little bit. You'll want to use these medications 5 minutes apart from each other so you do not wash one drop out with the other. A good way to keep track of all your drops is to take them at breakfast, lunch, dinner, and bedtime. Lastly, be sure to adhere to your follow-up appointments with your physician.